Welcome to Man in the Mango Tree. I am your host, Toby. With me today, we have Dr. Karen Mason.
Can I make a suggestion? I'm not really a Karen.
Are you?
It's my face name, but I prefer Tonya.
So
Most people know me as Tonya.
All right, so it's Tonya. We've got with us Dr. Tonya. We're going to talk hormones, hype, healing, and all things in between. But first, I want to get an understanding of what made you start Glow Wellness. Did you just wake up one morning glowing and decide to share it with the world?
So I want to say it's been a journey for me. I was an ER doctor for a long time. I still am an ER doctor, but looking for that exit plan of the burnout is high. It's a very sort of stressful field. A lot of stress, a lot of trauma, a lot of adrenaline. And in addition to that, I'm getting older, right? So all the things that you do to sort of protect, to preserve your health. And so I started engaging those things. How to get well, how to stay well, how to just preserve my health. You become a woman of a certain age and you see your patients have strokes and diabetes. You see your friends and family members do that. So then you sort of think about all those things that you can do to sort of preserve that or maintain some sort of wellness.
While preserving your own.
And while preserving my own. So that's how it all sort of came together. Pre-COVID, I was doing a lot of telemedicine because as a working mom, there's a schedule that you need to sort of maintain. I need to be at home, but I need to do homework. I need to be present, but I need to work. And so that piece allowed the virtual landscape, allowed me to at least get some work in. And then COVID came and the virtual space, especially in the US, sort of exploded. So then I was doing that piece sort of 50-50. I still work in the US part-time. But when I'm here, I want to create a virtual sort of landscape, concierge, some telemedicine, simple things like I have UTI or I have a rash or my kid is sick and what do I need to do? Or I need my medicine refilled or my blood sugar is a little bit high. Can you help me with those sorts of pieces? And then on the aesthetic side, you become a woman of a certain age and, I'm a doctor. I use a lot of needles. Let me learn how to use some needles for, that aesthetic piece as opposed to the medical piece. So that's how that started. I know it's a long answer. I'm sorry.
No. But it covered quite a few things, and I'm sure we're going to peel back those layers a little bit as we go along. But you mentioned, U.S. part-time Caribbean. Mm-hmm. What is in transitioning to the Caribbean, Trinidad specifically? What is one wellness-related thing that Caribbean people still seem to think is taboo?
That's a difficult question, because I don't think it's just Caribbean people.
Okay, so give me a wellness thing that you think people think is still taboo.
I think a lot of people think that in order to get care, a lot of people still, well, I guess we're definitely in the Caribbean.
We're definitely under the mango tree.
I'll have insurance for my head injury.
That's a bird finished with his mango. Not to worry. That's why we brought the couch forward. You're safe.
Well, at least I know how to take care of myself. No, but I think the big thing that is, and it's not taboo, is people's relationship with food, right? People think that it's cultural in a lot of cultures, right? That you have to eat a particular way, and
correct.
And we're realizing after years of diabetes and all these things that those are probably the wrong things. And then people think that if you lose a fair amount of weight and you're a healthy weight, culturally it seems like she must be sick or
Yeah,
he must be sick. There's
definitely.
definitely something wrong with that.
Yeah.
I think the other piece that I notice with health is that people think that that cardiac piece is, you know, they got to get the cardio in and you're spinning on a, you're doing a lot of cardio and you're not really losing the weight, and I'm doing all these things and I'm not really doing a lot of these things.
Controversially, I'd say cardio is overrated, but that's another podcast.
I would say that I don't think that's controversial. I think I agree with you.
So, yeah, go ahead.
I think the final thing that I think that is, and it's not just here, it's everywhere, is that women's health is just really not focused on, right? Women are supposed to nurture and tough it out and go through all these things.
Yeah, I think it's definitely an underserved area, which is why I thought your taboo answer might have been hormone therapy.
Well, I agree, right? But I don't see that as the number one thing. I think the number one thing is still people's relationship with food.
Food is big in the Caribbean, I think so.
Well, yeah. I think hormone therapy is a big thing. I think a lot of women in their 40s feel like you don't get a medal for going through menopause, right? You don't get a medal for passing, getting through the night sweats and all that stuff. And all that does is just, give you bad osteoporosis. So there's that piece that I think is really not talked about. Agreed.
There's a lot of it kind of just floating around on social media and so on. How many times a month or a week do you hear, isn't hormone therapy dangerous, from someone who doesn't really read?
Well, I think that's the medical community's fault, right? So about 15 years ago, there was one really poorly done study. They stopped. They literally had a newscast and said that estrogen gives you breast cancer.
Yes.
And then the world stopped giving women estrogen. And and then of course it was a bad study. It was proven incorrect. But they never took it back.
Yeah.
And the way that it came out, they haven't really taken it back. So, a very good friend of mine, she and I had this conversation by text 2 days ago, because she's 54.
Mm-hmm.
She's trying to lose weight. She can't lose weight. I said, I feel like you've been in menopause for 10 years at this point, because I've known her forever. She's my son's godmother. And she's like, yeah, and her DEXA scan is horrible now, and she wouldn't take the estrogen because she's scared of getting breast cancer. And she's a nurse.
Whoa.
And I'm her friend, and she never said anything to me. So, I'm like, well, you need a patch, and you need some progesterone. Because, that's going to help.
So.
And she's going to kill me when she sees this.
That's all right. I'm sure she'll understand. Obviously, I'm going to keep the Caribbean context on it.
Uh-huh.
And you mentioned the patch and other forms of access to hormone therapy or modalities. What do you think would happen if more people treated or viewed hormone management, if we could call it that, the same way they viewed, booking the carnival costume and planning for carnival?
Well, I'm going to tell you this. I think especially a place like Trinidad would be phenomenal if they treated everything like a fete or because I have friends who organize these parties. I've seen people put these productions together, and they get it done. It works like a machine. And I mean, I guess there is some logistics and there can be chaos, but no country in the world or nothing that I have seen people can't put together a Fed like Trinidadians. And if they can put that sort of energy could go into the banking system or just any other thing, it would be amazing.
Put in Tonya, in the Ministry of Efficiency with this theory.
Well, let's kind of stay away from that whole DOG having like US trauma from departments of efficiency.
Yeah, I know that would go there.
I don't know how to say this without just saying it, but I feel like, and I'm not sure because I'm a new replant, so I don't want to step on toes and things like that. But I feel like there's still a lot of, there's not enough access to some of the medications here. I don't know how to make some of those things more available. I'm sure there's avenues that I sort of need to continue to investigate to figure out how those things would happen. But I feel like there's the regulation, which is there, but the access for women's drugs for women, it just doesn't seem like it's there enough.
So if I think about that concept of access, and I guess that leads to people doing their own research, and then I think about your friend who's a nurse.
Who has access.
Who has access.
Yeah.
And probably not wanting to tell you, and probably doing her own, what is it, WebMD or whatever it is. What is, in your experience, like one of the wildest self-diagnoses that you've ever had somebody come to you with?
Oh, Lord. That one's too hard. You have to remember, well, you wouldn't remember, but I'm an ER doctor. I've heard all kinds of things.
Well, that's why I asked the question, because I want to,
I've heard all kinds of things, but, like people will say to me that they have do you have diabetes? No, but I'm not claiming that. So that to me is like,
So they don't identify as diabetic.
They don't identify as diabetic, or I'm on blood pressure medicine, so I don't have high blood pressure.
Fair enough. So we're going to sort of spin it back into some more wellness frame.
Uh-huh.
What is the one sort of wellness request that you would just love to ban and no one can come and ask? Like quick fix that people come to you with, that you wish people would just stop?
I don't know that I have one of those. I think people who come to me understand that they know that I will tell them there's no quick fix.
So you don't get the "can I get abs in 2 weeks" request?
No, I don't get those. I don't get those. I will get, "Can I have some antibiotics for my cold?" And I'm like, you probably just have a cold, so you probably don't need antibiotics.
I'll have to write that one down, antibiotics for the cold.
Yeah. That's a big one. People they have a cough, they want antibiotics, they think their cough's going to go away. And guess what? 2 weeks later, after the initial viral flu piece is there, you still have that post-viral cough because your lungs are just starting to get better, so you're still coughing. And they just think that 2 weeks later, they should be better. But the viruses have gotten smarter, and the inflammation hangs around for a long time. So when you are sick with the flu or any sort of upper respiratory infection, it's not uncommon to have a post-viral cough for 2 weeks after.
Gotcha. So let's play a little game of hot or no.
Okay.
Celery juice.
Eh.
Infrared saunas.
Yes. I do like infrared saunas.
Why do you like infrared saunas?
Well, I like red light therapy. So that's probably not the same thing.
Not quite, but
not quite the same thing. But I do think red light therapy is great for most sorts of healing. I have a Star Wars mask for my face. I got something for my neck. I got a thing for my head.
Do you have a voice to go with the mask, or is it just...
No. but it muffles, so I do have that kind of thing. But yeah.
Detox teas.
eh,
Mm.
eh,
I
not.
saw this one on Instagram post. I have no idea what it is, so I'm going to ask you. Seed cycling. Do you know what that is?
No, I don't.
One for both of us to look
Yeah,
up then.
yeah.
And I'm going to throw the dart out there. IV drips.
Well, I like IV drops. I think there is a place for it. I think it's for busy people who are, it's hard to stay hydrated. I think after lots of events or when you're ill, I mean, we give IV drips to people when they're ill all the time. I mean, that's what I mean. I grew up on doing that to lots of people. It's hard to get hydrated. But, there is the theory that you can sort of orally rehydrate.
Right.
It just takes you it takes you a
the
while.
time.
It takes you, and you can take a liter. It goes where it needs to go intravenously. The nutrient piece, though, to some degree, you can filter that and urinate some of that fairly quickly. So I'll give that piece. But the hydration piece, it's pretty much a quick fix. You have a headache, a migraine, you are dehydrated from diarrhea, or you're ill. That's sort of what we do in terms of medicine. So I know that there is that wellness piece to the IV hydration that exists. A lot of people use it post parties and things like that. It became big in places like Vegas and Miami. So I understand why a lot of people, or a lot of, we'd say, the older practitioners and providers will think that it's a farce. But we use it when we're sick.
So why not?
So why not when you've, sort of overextended your body?
So, and thinking about, because you mentioned, we use IV drips like in the ER setting.
Yeah.
And thinking of getting to that point of needing drips. What are 3 signs, or what 3 signs can you think of that our body's screaming for help, but we're probably too tired to notice?
Well, the first thing is that you're too tired to notice. The headache piece.
Headaches.
Yeah, the headaches. And then, one of the last signs will, just be the, the dry skin, the tenting, those pieces. But the headaches, and the headache piece is a big piece. Or in that lack of energy. That lack of energy is just a big piece.
So early on in the conversation, you referenced age a little bit. What is one wellness protocol that you would put all 25-year-olds on if you could?
Sunscreen.
Sunscreen. Oh, that's a real low-hanging fruit, no pun intended.
Yeah, no, sunscreen. And I know that especially in the Caribbean, right? We're close to the equator. There's a lot of sun. There's sun all the time. Sunscreen is the aging piece. With sunscreen is, it's just there. You expose yourself to the sun, you get dry skin, you get wrinkles, you get melasma. If you somebody who hyperpigments after you scar, you get those. So sunscreen is the biggest piece, and I would say non-US sunscreen, because the filters that they have in US sunscreen are really outdated. So more of the Asian, European sunscreens.
You are the person behind M Glow Wellness. What should women in their 30s be doing to make sure that their 50s are fabulous? I feel you might know something about that.
Sunscreen.
Let's add 2 more things in.
Okay. Your relationship with food. So just making sure that you eat well. Less processed food, sugar. But the processed food is key. Protein, lots of protein, figuring out the protein piece, high dense protein foods. And then strength training. Because in your 30s, you want to prepare. I mean, some women go through perimenopause in their late 30s, right? So your estrogen starts to go down, and or you have something, any sort of procedure, and then you have to lose ovary or anything like that, right? So strength training is a big piece because that sort of protects your bones and building muscle mass and helps with osteoporosis and all those things. And the one thing that we know about that strength training piece is not only is it good for physical wellness, it's also good for mental wellness.
So I have two more questions for you.
Mm-hmm.
Staying on, so you mentioned the estrogen dropping. Is it possible to naturally balance our hormones, or do we need to stop pretending that kale is the answer for everything?
I don't know if kale is the answer for everything, but kale is actually not a bad thing. It's a really good green leafy, fulfilling sort of.
I'll keep that in mind.
Fulfilling sort of vegetable, right? It's not the answer for everything, agreed, but it's not a bad choice, right? I mean, people talk about there's yams and there's all of that other stuff. I mean, you can eat to some degree some of it, but there's nothing like the exogenous estrogen that will really make a difference in your life.
And we're going to circle all the way back to carnival again, because that's a big driver. If you could build a glow-up kit for a carnival queen, what would that kit have?
Oh, Lord. A glow-up kit for a carnival queen. Sunscreen.
I had a feeling I was going to be in there.
That's going to be a hat. I know a lot of women don't like to wear a hat, but there's a lot of sun. So sun, a hat, hydration, and my two favorites, one antioxidant would be glutathione, a fair amount of vitamin C, and my new best friend, NAD+.
NAD+. Love to hear it. Thank you very much for your time this evening, Tonya. Folks, go follow Glow Wellness. That's EMM Glow Wellness on Instagram. Definitely book your consultation, your IV, NAD+ shots with Tonya. Until next time, man in the mango tree, out.